Charles Krauthammer on Fox News is going to say something about healthcare that's pretty shocking to everybody.
It was 4 years ago this week that the president made this promise.
It'll take 4 years to implement fully many of these reforms because we need to implement them responsibly. We need to get this right.
So, fast forward 4 years, are we better off now? Charles Krauthammer, back to react. Of course, the author of Things That Matter, 10 weeks at #1 on the New York Times bestseller list. Are we better off?
Look, I think there's sort of a general understanding, and particularly among Democrats who have to run for re-election at the end of this year, that this is a disaster. I think a single-payer system would at least have been logical and simple, and if that's what liberals had wanted, that's probably what they should have gone for. But this sort of insane hybrid, which is essentially the federal government taking tens of thousands of pages of regulations for the insurers, is a system that doesn't work, and everybody can see it.
Did he just praise single payer? I think he did. He said it's, quote, logical and simple. You know what this is? I don't want to give him too much credit here because he's not praising it on its own merits. He's not saying, yes, I'm in favor of it and it's a good system. What he's saying is, I call it the anything but this syndrome. And what that means is, simply because they want to attack Obama so badly, they're even willing to give credit to more liberal ideas than what Obama does, as long as it's not the thing that Obama did or the thing that Obama's in favor of. Because again, the main goal is just attack Obama. Attack, 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 attack. So if in the process of attacking him, you come out in favor or, give some sort of credit to an even more liberal idea, well, that's fine, as long as you're achieving the end goal of attacking Obama. And that's what Krauthammer is doing here. Now, I can't even tell you how many times we have gone over these basic facts on this show. So let me break it down for you one more time. Obamacare, the heart of it is called the individual mandate. And what that is it mandates that everybody has to buy their own health insurance on the private market. Of course, it expands Medicare and, raises it to 133% of the poverty line, which is a good thing, don't get me wrong. But it makes it so that everybody else needs to go to the private market, private, the key word there, the capitalist marketplace, and buy their own insurance. That is a Republican idea, quite literally. It is your plan, Charles Krauthammer. Richard Nixon originally came up with it and proposed it back when he was president. Then later on, the Heritage Foundation codified it. So they wrote policy papers about it and said, this is what we're in favor of. It was their counter to Clinton Care, which was more government-oriented and more socialistic in its implementation. You also had Republicans like Newt Gingrich and Chuck Grassley in the 1990s just openly in favor of it. In fact, Republicans in the House of Representatives back in the 1990s, they loved it. This is the plan they wanted to implement. So, yeah, I agree. It's not as good as single payer. I wish we had single payer. Another way of describing that is Medicare for all. You just have, a certain amount of tax dollars just fund everybody's health care, and that's it. Instead of all of our money going to stupid shit like wars, we could actually fund people's health care. I agree. That's the superior system. But to say that this system that we have now, which granted is the Republican idea, the individual mandate, to say that this is worse than what we had before, that is totally counterfactual. And I do mean counterfactual. This isn't like, an area of opinion where Charles Krauthammer could say, well, why didn't we just leave the system the way it was? It was better that way. Wrong, demonstrably not true. And I can explain it to you. So, for example, you have 30 million or 40 million plus people who were uninsured under the previous system. Now the uninsured rates are dropping tremendously because of the implementation of this plan. And furthermore, 45,000 people died every year because they didn't have access to basic health care back under the previous system before we did any reform whatsoever. That was a Harvard study that found that. That's insane. In the rest of the modern world, that's 0 people in all the other countries that die for that reason. Well, now that number's dropping tremendously because of Obamacare. So if you had to grade the systems, it is the most primitive one is the one we had. Just a purely, free market, wild, wild west system with private health insurers robbing from everybody, no coverage for pre-existing conditions, price gouging left and right. And then better than that is the individual mandate, which is what we did here. It's Obamacare. It's the Republican plan. And then obviously the most superior one, according to the studies, is single-payer system.